I'd like now to introduce Lew Finfer, who, as I mentioned, is the director of the Massachusetts Communities Action Network. Many people in Boston will say, I learned everything I know about community organizing from Lew Finfer. And he's an amazing man, and he's here because he wants to talk to us about Jobs Not Jails, which is a movement that has some very specific actions that we could take over the next few months to help support. And as we know, jobs are an essential part of health.
Yes.
So, Lew.
Thank you. We also, I also do want to point out that many of our CHNAs look at youth violence, and that's very much tied into what Lew is going to speak about violence prevention, youth, quarries, how we deal with that.
Thanks. Thanks, Dave, for having me, and thanks, Wendy. The group I work for, and appreciate your giving time to this issue. The group I work for, Mass Communities Action Network, has affiliates in Boston, Lynn, North Shore, Worcester, Springfield, Brockton, New Bedford, and Fall River. We've worked for 31 years in the state. We're also the co-chairs of Raise Up Massachusetts that did the campaigns to raise the minimum wage in 2013 and 14, and the passage of the Earned Sick Time referendum. And now we're working on minimum wage again and moving toward the ballot with sometimes called the Millionaires Tax or the Fair Share Amendment, which we hope will be on the 2018 ballot, and it would provide $2 billion a year in new funding for education and transportation, which I know that will also connect to your work. Because it's been very dry up there, for revenue on Beacon Hill. I'm going to pass this around. You don't have to read it, but it's more kind of the thing to pay attention to is that this is a letter signed by the Governor, Senate President Rosenberg, Speaker DeLeo, and Chief Justice Ralph Gantz. And the letter is basically inviting in a study that's going on now that's going to result in legislation that's filed in early January on criminal justice reform. And as someone who's worked for now 46 years as a community organizer and spent a lot of time on working on campaigns at the State House, the last time I can remember, let alone before, the three filing a bill together was, I think, the 766 legislation in 1974. So in the real world, they never file a bill together. It's the legislators file a bill, or the governor has his bill, and he negotiates later with the Speaker and Senate President. But for them to, I'll pass it around, for them to say they're going to file a bill together creates an opportunity that something, an expectation that something will pass. On the other hand, we're not so starry-eyed that in the real world we know we need this much when we're looking at the issue of incarceration and access to treatment and reentry services and sentencing and youth violence, all those different dimensions. We need this much change, and left to themselves, even though I think some of those four want to do something, but left to themselves, given their standing and their differences and so forth, they're probably going to start out saying we're going to do this much. But again, they've opened the door and created this expectation. So I'm going to pass another thing out, but you don't have to read it because I'll really be going over it. The one thing that we did get done, we actually filed a major omnibus bill in 2015 called the Justice Reinvestment Act, dealing with a lot of these issues. The one thing that did pass on that is sometimes called the repeal of the penalties on ex-prisoners getting their driver's licenses. So I'm going to pass around an implementation brochure on that. That punitive law from the war on drugs period basically used to make people wait up to 5 years to regain their driver's license and have to pay a $500 fine. So imagine you get out of prison, jail, you have no money, and most of the low-wage jobs, many low-wage jobs you apply for require a driver's license. Even if it doesn't require a driver's license, they aren't all on MBTA stops in Boston, et cetera, et cetera. So this hung up 7,000 people. But all the other things in the bill were deferred because of this process that the Governor, Senate President, House Speaker, and Chief Justice started. Now the study is going to be done in December, and the 4 leaders are supposed to file their bill in January. The study group is, in a sense, been reasonably accessible. We met with them 3 times, different coalitions of organizations. We even got them to meet with ex-prisoners that our coalition members put together, meetings for them, and who were held in New Bedford, Springfield, and Worcester. But no one knows what they're going to recommend. On the other hand, whatever they recommend, there's no guarantee it'll be in the bill, though it'll be a place and time. It'll be interesting if any of the things that people think are needed are put in the bill. So the opportunity is now. The other thing is, all of you have kind of been asked to, I'm sure from many times, will you call your legislator about this legislation? I just heard, will you come to the hearing? Will you organize people to go to the hearings? In a normal year, of course, one might say, what's normal in our state or up in Beacon Hill sometimes, but in a normal year, you know, you may work for a bill to be filed, or you may be informed a bill is to be filed, and then in the spring, you might say, I'm going to go to that hearing, I'm going to tell other people to go to that hearing, I'm going to write and call my legislator, I might be part of a local meeting with legislators. That's sort of what the drill is when we're all working on legislation and budget. But we think we have to start earlier, because they're filing their bill in January. So the dynamic kind of can be, if I was one of them, in a certain kind of way, they might say, hey, we had this big national study done, we got their recommendations, we sat down, we're the heads of government, and this is what we're going to do. And they're not going to go so far publicly to say that's it, but it can fall into that framework. So we're going to try to act before January. Where, as a statewide coalition, we're trying to come up with a set of priorities. There's kind of an endless list in a certain kind of way. We have one list we're working on that has 25 different proposals, but we're looking at things like, we kind of break it down before prison, during prison or jail, and after. So before prison, we're looking at things like a pre-trial diversion to treatment. So if someone had a crime that was drug-related, a property crime, and they were assessed by someone, there would be a new kind of role in the court. They could be, in a sense, assigned to treatment, and if it worked out, they would not go to court, and they would not go to jail, and they would not get a query. That's pre-trial. Drug courts are good, and we work to establish drug courts, but if you're in a drug court, you're in the prison, the court system, and you get a query. And other idea, ending what are called long mandatory minimum sentences for nonviolent drug offenders. They're very long sentences, they're automatic, the judges have no discretion under the current system. There are huge racial disparities. I think it's something like 16% of the population, statewide population, is people of color, and 54% of the people in prison are people of color. There are huge racial disparities. Chief Justice Gantz has actually written eloquently about mandatory minimum sentences, how, you know, 40% of the people charged are people of color, and 75% of the people in prison for mandatory minimum sentences are people of color. So there are huge racial disparities in play here. You know, a lot of this goes back to those kind of sentences, the war on drugs and those effects. We have 236% more people in prison since 1980, and the crime rate is down in the state 26%. So it kind of doesn't seem to sort of fit. So we're going to try to set up, and then in prison, things that are coming up are more programs. There's 10,000 prisoners on waiting list to take a job training program or anger management program. If you participate in a program, you can get what's called good time to reduce your sentence. But if you're on a waiting list for a program, you don't get any good time for attentions. And I'm sure you know from your work out of prison, I call it the three-legged stool of stability: jobs, housing, and treatment. Each of them is full of a lot of holes, and that stool falls down one of those legs, and often it's more than one of those legs in terms of people's chances. I just met with one of our allies at a group called Project Right in Roxbury, and he talked about people living on couches because they can't find housing. Some of the rules of subsidizing public housing: you can't go back if you have a prison record. It's a lot. Quarry is like walking around a little bit with a ball and chain on your leg in terms of your chances of getting hired. So there are all those things. But we're looking at all those things to put into the proposals. probably in early December, we will try to have some public event. It might be a rally, a press conference. We might meet with some of those four, but some kind of public event, which we can let you know. Basically, we want to get out in front of them filing the bill and say, here are the 5 or 6 things that would really make a difference in changing the picture we've been living with for years, and we're asking you to put them in your bill. So we don't want them to be able to say, well, where were you? Well, we're going to try to be there. We're not going to stop there, because the odds are that a lot of the things we want will not be in their bill. But in February, we're looking at possibly, and you could also participate locally, in February looking at, it hasn't been finally decided, but the idea that's on the table is to hold a meeting, perhaps one of the Saturdays in February, to hold it in six or seven cities in the state. The same time, and hypothetically would be like 10 o'clock. We're there in New Bedford and Lynn and Brockton and Worcester and Springfield and Boston. And we're trying to gather many hundreds of people to each meetings, and we're going to present the issues that we're working for. We're going to ask state legislators, police chiefs, mayors that support us to come and publicly say they're with us. And then at 11 o'clock, we're going to try to video conference all those meetings into one meeting. And as far as I know, I can't think of a community kind of group thing who's done that. I've heard of politicians doing electronic town halls, but that's a politician sort of, running things. This would be, so, and if it worked out, it would mean if I was the person asking, if I was in Springfield and I had the assignment to ask Governor Baker about will he support adding these things to the legislation, and Governor Baker is sitting in the meeting in Lynn, then I could ask the question, it would be on screens and everybody would see what everybody's doing.
Very cool.
I hope it would be cool.
Very cool.
And we get a lot more people because it's not just going to one
And that
place.
one person doesn't have to keep going to all 6 places.
Right. They just have to go to one place, but a lot more people could go. They wouldn't have to all troop to one central place. And there'd probably be a lot more leadership opportunities for people. In 6 meetings, there's a lot more opportunities to run the meeting and have testimonies and participation than there is in one meeting. And honestly, the local media, daily papers in those regions would cover it. If I was the Fall River Herald and there's a statewide meeting in Boston, I'm not going to go cover it, even if 100 Fall River people come. I'm probably not going to cover it. But if there's a meeting in Fall River, New Bedford, I'm going to cover it. So that's kind of the picture, and maybe I can stop and see if people have questions about the policy or the ideas of policy that you think should be part of it, or about the organizing of the effort. I'm also going to pass around, and how many more minutes we got?
About 15.
Okay. I'm also going to pass around a sheet, and if you are interested in this in different ways, it could be at certain points I'll be able to write and call legislators, I'll be able to organize others to write and call legislators. I might want to come to the December meeting, I might want to work on the local meeting that'll be in my region. If you're at all interested in any of this, just put your information here and then we'll be in touch with you. But let me start, see what questions you had.
I attended a Ralph Nader weekend at Rowe Conference Center, and he...
Is that Connecticut?
No, it's up in Rowe, Mass.
Oh, Rowe, Mass.
On the border in New Hampshire. And he posed a new civil action called a summons. And what you're describing sounds a lot like his idea, where you gather a number of people together, at least 500 it would take, and you summon the elected official and ask him, in a community meeting, at which your electronic meeting would do beautifully.
Right.
And we organized people from Massachusetts already willing to do a summons, but it didn't, so that group is there, and
yeah, we could tie into that if they're interested in, it's trying to create accountability, because all of us have been to State House hearings. Kind of not that exciting. I mean, it's exciting if a lot of people come and some of the testimony is moving, but it's kind of a one-way street. All the legislators sit up, and once in a while they ask the question, usually only ask the question of other legislators, and there's no back and forth. It's the nature, and in some ways that's the format. but there's no back and forth. By having them come to a meeting that we're organizing, it creates a little bit more of a chance for accountability and back and forth. But especially accountability, like people are meeting because they want this bill improved, and here are the things they want, and where do the candidates stand on this, and then leading to where the other, not candidates, but the big four political figures leading to where do our legislators stand.
Why would that meeting be after the bill is offered?
We're trying to do something in December, like I said, and then something, we did think of doing those kind of meetings like you're saying in early December. Some of the members of our coalitions are caught up a lot with working on the voter education, voter registration because of the election. So some of them just said like it would be hard for us to, 3 weeks after the election to do that. Originally we thought we should do that, but the compromise was to do some kind of action in December to at least publicly put the flag in the ground, this is what we want, and then do the follow-up. Because the legislation can change with pressure, though obviously we need to do something before, but it was a good question. Wendy?
So yesterday, I was at the Children's Trust conference on fatherhood, and they had Joe Jones from Baltimore there from the Family Center, and he was talking about men that are in arrears on their child support payment, and that they take away their driver's license, their plumbing license, their electrical license, and that Baltimore worked out some kind of system so that if they get these guys into work-study programs and into GED programs, then they begin to reduce that debt, and eventually that they can make that debt something that's manageable, and the guy ends up with the job. Do we have anything in the horizon that we're looking at for this kind of stuff?
There was a bill that we worked on last year that passed one branch to reduce, to make probation and parole fees voluntary, or reducible, because that's a big hang-up for people when they get out of prison. We also had a meeting with the Department of Revenue, which enforces the child support. About some of those things, they're starting to close the gap, but of informing people once they enter prison, if they file a certain kind of affidavit, the fees and penalties and so forth can at least be frozen the time they're in prison, because otherwise they just
Right, they come out with $50,000.
Right. So that's one of the things we're looking at, all those fees issues that you mentioned, because they're additional barriers, and even to, like you said, you can not get a license because DOR said you didn't pay this, and they tell the RMV, and you can't get a driver's license.
Well, there was a lot of excitement yesterday. This was at UMass Boston. There was a lot of excitement about doing something here in the state on those issues. So you might want to connect with Ajay Shara from the Children's Trust Fund.
Okay, I will talk to them. We know them. Ajay Shara?
Yeah, Shara.
Okay, thank you for bringing that up, Wendy. That's helpful. It's also helpful to have models of other places, because that helps. It makes it real, and it helps legislators think they're not walking off the deep end.
Right. Someone else. It's always good to say, well, they're doing it.
Right. Yes.
What do you think is the biggest barrier to someone coming out of prison? Because, we see different things where we sit. When someone comes out of prison, it seems like they don't really have many supports. And then, you have the housing issue, like insurmountable things coming at you. If you could ask for one thing for this population, what would it be?
Well, I think it's kind of like, I don't think it's one thing, but I think it's kind of like a certain way I'd say it would be case managers and resources.
Yeah.
And it may be retraining parole officers in a whole different way, or it may be creating a different kind of person, even if the old parole officer, probation officer, does their own old sort of violation-oriented work.
Right.
But in a sense, someone needs that. DPH is moving toward, they have some navigators in some places, which are, and they're trying to move toward more of that, which is, in a sense, for people, the treatment part of people's lives, to try to do that. I think there's something pending with I forget what it's called, where you get some kind of change in the Affordable Care Act to make, to do different experiments. They have something pending that they're going to get a decision this fall on, which may let them do more with that in treatment. But
Because does everyone get a parole officer when they leave prison or not?
probation,
Probation officer?
it's very, not everyone does because
Right.
of some of its resources, and then some of them are sentences. Some sentences require it, some sentences don't. But you could set up a system like this. And part of the thing is that it's good that DPH is moving toward that with the resources of using more navigators and so forth. But again, that's one leg of the stool. What about housing? What about jobs?
Another comment we would probably make is that have an expert identified, at least in the DTA office, who works with that population. Because we were next door to DTA, and we kind of sometimes, people float into our office and we have nothing to do with DTA, but they really don't know where to go. And when they go to DTA, it seems like they just get the brush off.
Right.
So maybe identifying that as an issue and going into the DTA office and, you know, like they have a vets affairs person,
Right.
maybe a person who could kind of be a little expert in
Right.
what these folks need to do,
Right,
you know?
some services.
Probably
Well,
the,
isn't
go
there
ahead.
Isn't there someone, like, that helps them with the discharge plan, so to speak? That
Sounds like-
Some prisons and housing, they do discharge plans, but then the thing is,
When you go-
where's the follow-up?
there's no follow-up.
Sometimes it's like, go here, if you have housing, go
DTA,
here.
you know, they
And
can't help.
some people may go one place and feel
Yeah.
like it didn't go, or some people.
There's no tracking how they're doing.
Yeah, it's, so there's some, if they get to some places they do get help, but sometimes they don't get there. Or they have multiple problems. Maybe it's health, maybe it's medications, maybe it's healthcare, and it's not housing and jobs and treatment. So if there was some kind of way, I mean, some people have talked about they should have like the building right next to the prison, when someone gets out, that should be
they
there.
stay there
But-
short-term.
But also, it could be if you had someone who both either had the skills to be the case manager in those areas. Obviously, they don't have to know, I'm not a kid, know the ins and outs of each of those areas, but they need to know the ins and outs of how you get to the door and get, you know, but maybe if that was part of their probation, that they had to go, you know, sometimes you have to report to probation and so forth. Right now, it's just reporting, you send in a form, or sometimes you go in and so forth. But if you went there and there was something there to deal with these, you know, case manager type of role, then there would be some place that people are getting, they're accountable to come, but they're also, it could be worthwhile to go because you're getting connected
Maybe
to.
that navigator term, because I'm seeing with some folks that have, I wouldn't say severe mental illness, but challenges, maybe severe ADD, dyslexia, people like this, that within the health system, they're giving them these navigators to help them with life skills.
Right.
You know what I mean? So that's really helpful to have somebody else look at that and just help organize.
Right.
And
You know,
peers.
We have a lot of guys, we do the nurturing fathers program, so we get a lot of guys that are coming out of jail, and the reality is that there's no housing for them. They've just changed
Right, housing.
the housing requirements just recently.
Yeah.
So you have to either be living someplace that's unfit for human consumption, you have to have a DV, recorded DV incident within 30 to 60 days. Domestic violence, so you can't say that, you know, the perpetrator's been after me, you have to have reported to the
Yeah.
police, it has to be within 30 to 60 days. I'm trying to think what the other one was. But it was so limiting that none of the guys that come through our office fit any of the requirements for
Right.
housing. And we went to the South Coast Homeless Network last week, and basically there's the new number 1-800-HOMELESS,
Yeah,
and you call, and if there's no housing, you're on your own.
that's what we've seen.
So how are we
They're
gonna
given the
help,
list.
how are we gonna
Shelter.
help people re-enter into society if we can't even get them into a house?
And the person did the crime, may be back in prison, and their family consequences, so it's just continually unraveling, and consequences to people. So,
Maybe some of these old hospitals that they're closing, right? The old hospitals that they're closing, they can make them into some, you know, affordable housing.
right. No, there's gotta be more of that, more of that done, for sure, yes.
So on the flip side of the handout, it says accomplishments, and then it says, in the 2016 law that repealed $500 fine and up to 5-year wait for ex-presidents to regain their driver's license. So that's not a problem anymore?
It was repealed, so it's not a problem, and that sheet, the blue in it that went out is, did you get one of them? That has the, it is a problem in that if you it may be like a certain sense, if you're behind on child support and then it's reported to DOR, to RMV, they may not give you a license. So it's not like a blanket, it's not blanketly solved, but it's solved in a larger way, because it used to be everybody had a major fine, everybody had to wait. So there's still people who get hung up, but
Right.
it should be a lot less. There were about 7,000 people who were hung up each year because of not being able to get their licenses in a timely way.
Great. Thank you, Lou.
Thank
Thank you
you.
very much.
Good job.
Thank you for having me, and I'll follow up with you.